My name is Josephine Birungi. I'm a medical doctor with public health training. Currently employed as a senior scientist with a few years of working with patients with non-communicable diseases. With very many years of experience of working with the HIV patients and currently the MRC UVRI based here in Entebbe. I am a project lead, a role I've held since 2018. Respond Africa has research projects in Uganda, Tanzania, and Cameroon, but I lead the research projects, coordinating the team, the implementation in Uganda. So in 2018-2019, we conducted one pilot project called MOCA, looking at integration of HIV care in diabetes and hypertension. And that led to another more robust cluster randomized control trial, Inter-Africa. Inter-Africa is also looking at integration of HIV care, diabetes and hypertension in 17 primary healthcare facilities here in Uganda. So I lead that. Seeing things improve and working with the policymakers to see what actually is being done so that they can get the evidence. It's been very, very interesting for me, very enjoyable and satisfying that they are always asking what's working, can we work with you, can we support you. I think I enjoy that, and also seeing the teams become better, the teams that I work with. So in my early years in high school, there were this group of women scientists in Uganda, engineers, doctors, who had formed a group. That group looked out for female students who had done exceptionally well in 4 regions of the country. And they came out to our schools, and I was recognized as one who has done very well in that region. That was comprising of about 7 districts. So I think from their talk, I picked interest. I said, I think this is an area I should pursue. But initially, I was studying just to make sure I get a good job initially. But that interested me to do science. But then when I finished school as a medical doctor, I was employed by TASO at a rural HIV clinic. And at this rural clinic, I also met researchers who are doing research. I was providing care, but I met researchers. And among those researchers was Professor Shaba. That's about 20 years ago. And I saw how this Professor Shaba was doing work along with other researchers. And what came out of that research informed guidelines by WHO. So in a way, I didn't plan it, but it kept evolving organically. The government has provided an environment in this country for women or for girls. When you're joining university here in Uganda, there are certain points that you're supposed to score from your high school, and usually for girls they add you 1.5. So if you get say 30, they will say as a girl you have 31.5 to enable you join the university. So that's also, the environment is conducive, but the opportunities are available for everybody, just that the environment is conducive and your counterparts treat you well. So saying the MOCA study, which is management of chronic conditions in Africa, was a pilot testing the feasibility, the potential costs and benefits, and acceptability of integrating care for patients who have HIV and those who don't have HIV but have diabetes and hypertension. So essentially bringing negative and positive patients, as long as they had HIV, diabetes and hypertension, into one clinic. Working with the Ministry of Health, we wanted to see whether we could bring this together so as to improve chronic care, especially at primary health care facilities. And I'm happy to inform you that actually we found that it's feasible. Over 80% of the patients we enrolled into the study were retained in care, because that was one of our endpoints. Will these patients be retained in care at the end of at least 6 months? So the pilot informed us that it was feasible. We also saw that the costs were actually, it was cheaper to manage patients in the clinic, especially those with multimorbidity, and we thought it could be an efficient way of managing patients with chronic care. In terms of acceptability, over 80% of the patients were happy to be part of the integrated care clinic. So with that pilot, and after sharing with the Ministry of Health, they were actually very interested in seeing whether this evidence can be applied into policy. But because it was a short time, 6 months of follow-up minimum, I think most of the patients, we followed them for 8 months. There was need, since it was a small study in 5 primary healthcare facilities in Uganda and 5 in Tanzania, that's 10, there was a need to take this to a larger scale, more robust study with the gold standard, a cluster randomized control, or a randomized control trial, really. So that's how we now come to Inter-Africa. MOCA had been funded by the National Institute for Health Research. Using MOCA as the study and the findings and what we had done, we were able to write a grant and obtain funding from EU for Inter-Africa. Inter-Africa, which is a cluster randomized control trial, as I said, in 17 primary healthcare facilities in Uganda and the 15 in Tanzania. That's 32. We plan to scale this up, but still doing the same thing, doing the effectiveness, studying the effectiveness of integrating care for HIV patients and diabetes and hypertension, irrespective of the HIV status, comparing integration and the standard of care, where the standard of care is people get care in their vertical clinics. So I should say, one, that it's manageable. I know that there's a time when we're growing up and saying science is for men. No, it is manageable. As in you can actually do it. That's maybe what I should start with. But there are things along the way you need to associate with the right people, the people who have taken the path before. Look out for them and work with them at whatever stage, whether you're still in high school, whether you're in your early career. So the right people to help you along this path. But I would also say that as a woman, especially if you move into family, you have to learn how to balance. It's a unique role that no one will teach you, because it's unique to every individual. But you learn, you live one at a time. As long as you keep the focus that I want to make it in science, you just balance it.